This wagon represents Jane's body, and these horses are like the beta cells in her pancreas that make insulin. These hills represent the carbohydrates in her meals. It's easy for the horses to go up and over the hills initially. Then Jane gains weight, and her meals contain more carbohydrates. As Jane ages, her beta cells also age, becoming weaker or die off. Initially, Jane's wagon will start to slow down on the hills, but her speed will still be okay on the flat parts. Jane's lab tests will show a normal fasting blood sugar, but a high average sugar. This is called pre-diabetes. Many doctors will tell Jane to lose weight and lighten her wagon, but the real problem is that the hills are too high. If Jane gets rid of the hills, she can decrease the stress on her horses, and they will live longer and go faster. In other words, if Jane stops eating so many carbohydrates, she can delay or prevent the onset of diabetes. If Jane continues to eat lots of carbohydrates, her horses will die sooner, and her wagon will start to go slow even on flat roads. This represents progressing to full diabetes mellitus type 2. Eventually, enough horses will die off that she will have to use rental horses, which represents injecting insulin. At any point in time, Jane can significantly slow down this progression by getting rid of the carbohydrates. This is why a low-carbohydrate diet is used to prevent and treat diabetes.